Hi, I'm Lee McGuire, and thank you for joining us. I'm here at Advanced Surgical Arts with Dr. Dewey Lee, and we're talking about stem cells and something different that you might not have ever heard about before, intravenous stem cells that affect your whole body. Can you tell us a little bit about that? I'm excited to hear more.
Okay, so yeah, this is a little different than your typical stem cell story of injecting into joints and hair and aesthetics and all those kind of things.
All those important things.
Those are all very important,
Yes.
of course. Yeah, very, very important. But this is more of an idea that I've been formulating for a while. The actual real use of stem cells for so many people. And right now we're using it all for treating illnesses, right? Of various different types, or for aesthetic reasons to help growing hair and all those kind of things, which is great. But for me, I think stem cells really have the greatest impact as a preventive measure. Instead of waiting for something to happen to you, then scrambling around and saying, oh my God, I need stem cells, why not get yourself
Don't wait. We have a tendency to wait.
Exactly.
A little too long until we have a problem. People are slow to preventative, medicine.
We all are. But, the whole thing has to do with, getting your body to a higher level of, let's say, rejuvenation so you're healthier, because when you're younger,
having better maintenance.
You have a lot more stem cells floating around. So when you got injured, you got illnesses, you heal faster. When you get older, you just don't have that anymore. But what's interesting is there are tons of stem cells in the fat. And the technique that I use quite a bit is to actually extract a tremendous number of stem cells from fatty tissue and then inject
Where
it
do
back
you
into
take this fat from?
From the tummy. It's
Okay.
like a little mini liposuction procedure.
Do you need very much of it?
Not too much. No, very
So it's
little.
not a major.
It's not a huge deal at all. It's all
Okay, I
done.
see.
Come in, you
Right.
have a little procedure to extract some fat cells, and I process all that. I have a device that is very state of the art, extracts tremendous amount of stem cells, and that gets injected back into you and goes over the whole thing.
Intravenously.
Intravenously, yeah. There are various different ways to harvest stem cells from different types of tissues. So I came across this device, and I think it's one of the most advanced systems out there in terms of being able to extract the greatest number, or certainly maximize the harvest of the stem cells. So this is actually sort of a one system built into one. It has an incubator device to spin the cells, and there's a whole automated process that goes through to maximize harvesting the stem cells. If you need something in your joints or other things, that can be done as well. So it really has
So you do that as well?
Yeah, I do all that stuff.
So you can directly go in. But whenever you do this intravenously, it's helping, like if you do get a sickness or you've been going through any type of sickness, it helps your body rejuvenate quicker.
It can, yeah, because you're supporting your system. When there's something going on, your body needs stem cells.
So interesting.
Along with other cells to help
Right.
you, repair the damage and get better. So it's a big part of healing if you actually have a middle of illness, but also even before you actually have illness, to be healthier, get to a higher level of health. And we all talk about eating well, taking the vitamins and exercising, all those things. Of course, those are all very important things. That's all part of being healthy and staying healthy.
And being balanced.
Exactly. But if you don't have the actual cells that do the work, which are the stem cells,
As we get older.
as a big part of
Right.
staying healthy and staying youthful and rejuvenated
I want
and vibrant.
that.
It's a little novel idea, a little different than how people look at stem cells and how different doctors are using stem cells. So I mean, even though I do treat people with joint problems and other things, I'm really kind of trying to foster the idea of stem cells as a part of your overall health maintenance, preventive technique, and things like that. So
How many times do you have to do this?
generally, it depends on your age. If you're fairly young, young, 40s, 50s, once
little
a year,
baby.
one little
A
baby,
little baby.
once a year, maybe once every few years would be plenty.
So once a year?
As you get older, I think you probably need to get
Oh,
a little
more and more.
frequent. Yeah, I
Okay.
mean, I wouldn't say once a year. There's no real time frame with this. I mean,
So it doesn't hurt you to do it more than once if you want to.
No.
Thank you, Dr. Lee. It was really exciting to learn more about that. And if you're interested in having a little bit of stem cell therapy to help you for whatever is ailing you today, be sure to call Advanced Surgical Arts. I'm Lee McGuire. Thank you for joining us.